And on day 26, the effects of this shutdown are really starting to show, including how patients looking to battle opioid addiction get a life-saving treatment.
News Channel 5's Matthew Torres continues to dig into the fight against the opioid crisis. And Matthew, the shutdown can affect their access to a specific drug, right?
Yeah, and that drug that we're talking about is buprenorphine, otherwise known as Suboxone. It is an opioid used to treat opioid addiction. It's a drug first introduced in the early 2000s, but due to the opioid crisis, the treatment has shown a resurgence in recent years. New doctors looking to prescribe the drug require approval from a federal agency, which is now closed because of the shutdown.
The residential.
Dr. Khalil Saha sees the new year as a chance to become a new you. In his line of work, that means letting go of old habits.
People can be willing at this time to start something such as buprenorphine.
As the medical director for the recovery center Turning Point, he helps many fight their addiction to opioids. One way is through the use of another opioid called Suboxone, the brand name of buprenorphine.
Success rate is actually very good. A lot of it depends on the patient's motivation.
The drug can block the effects of other opioids and help phase out cravings. It can still be addictive, but patients say it does more good since the prescription is paired with additional treatment like counseling.
It's something that you fight, but it really helps you. It gets you through the day.
To prescribe the drug, doctors must go through training and receive a certification from the Drug Enforcement Agency. In Tennessee, nearly 600 physicians are able to, but less than 10% use it to their fullest capability.
You have to show the government that this medication has to be, that you're using it properly.
But because of the government shutdown, any new doctors wanting approval from the DEA to prescribe the drug will have to wait.
And the doctor's willing to give it, but unfortunately they can't have the license.
It's unclear how much of an impact it's having on Tennessee, but as one of the states with the worst opioid problems, Dr. Saha fears the shutdown will have a rippling effect.
It can go to any state in the country because there are doctors who have patients who possibly want to start this medication.
At first, the doctor is given a maximum of 30 patients to prescribe to. After a year, it goes up to 100 and more after that. Dr. Saha has reached a maximum capacity of 275. The shutdown could affect a provider looking to increase the number of patients. Rory?